If you're turning 65 and own a health savings account, you've probably heard a few things that aren't true, such as you can't contribute to an HSA once you turn 65. Coming up next, we'll clear up some HSA misconceptions and help you avoid any mistakes. This is the first of two back-to-back videos related to Medicare and health savings accounts. Be sure to watch the second video titled When Medicare Part A is Backdated 6 Months, which will be linked at the end and in the description below. A health savings account is a great way to save for future medical expenses on a tax advantage basis, even when you're Medicare eligible. But you need to be careful. Some important notes. A lot of bad information is passed around about HSAs, so we want to set the record straight. Additionally, this video will delve into taxes just a little bit. Since we aren't tax professionals, we can't offer tax advice. Please speak with an accountant if needed, but based on our experience and the information found in IRS publications 502 and 969, we believe this information to be accurate as of the release of this video. Here's the 4 topics you need to know. First, we'll clear up the typical misconceptions about HSAs. Second, we'll discuss the current HSA contribution limits before age 65, and then how much you can contribute the year your Medicare begins. Third, we'll briefly mention the tax consequences when you make contributions in excess of the IRS allowed amounts. And finally, we'll review the IRS allowed expenses specific to Medicare. You'll actually be surprised what you can use your HSA for when you're on Medicare. Alright, here are the 2 most common HSA misconceptions as they pertain to Medicare. Number 1, once you turn 65, you have to stop your HSA contributions. Simply turning 65 isn't what makes someone ineligible to contribute to an HSA. What makes someone ineligible is actually enrolling in at least Medicare Part A. There are 2 ways you'll get Part A: by proactively enrolling in Part A, or by receiving Social Security benefits, which automatically gives you Part A. So bottom line, you can keep contributing to your HSA as long as the HSA account owner does not enroll in any Medicare or Social Security benefits. That also means if you're the HSA account owner and don't have any Medicare, but your spouse who is on your health plan does have Medicare Part A, your ability to contribute to your HSA will not be impacted. Since you, as the HSA account owner, don't have any Medicare, all is good. You can still contribute up to the family HSA maximum. Number 2, you have to stop HSA contributions 6 months before you turn 65. We've already established that you can contribute to your HSA beyond age 65. So why would someone think they need to stop HSA contributions 6 months before they turn 65? Well, the confusion originates from a weird 6-month backdating rule associated with enrollment in Medicare Part A. Here's the deal. Assuming Medicare eligibility based on age, the earliest Part A can start is the first of your 65th birthday month, or 1 month sooner if you have a first of the month birthday. So HSA contributions prior to your birthday month are totally fine. If you enroll in Medicare and/or Social Security in your birthday month, or any of the next 6 months, Part A will backdate to the first of your birthday month. You would again have the same HSA contribution eligibility for the months prior to your birthday month. But if you enroll in Medicare and/or Social Security more than 6 months after your birthday month, Part A is backdated the full 6 months for sure. This is the scenario that catches people off guard and can negatively impact their HSA contribution eligibility. We nail down this point further in our companion video linked at the end and in the description below. Be sure to watch that next. Okay, now let's get into the HSA contribution amounts prior to the year you start Medicare, as well as the year you do start Medicare. This video was created in 2023, so we'll show the 2023 HSA contribution limits for individuals and families. If you're covered in what's classified as a high-deductible health plan, here are the contribution limits, which are employee plus employer combined. Individuals can contribute up to $3,850. Families can contribute up to $7,750. And then individual HSA account owners who are age 55 plus can make an extra catch-up contribution of up to $1,000 on top of their individual or family max limit. But this all changes the year your Medicare Part A starts. Your contribution amount is prorated based on your Part A start date. Let's say your Part A begins April 1st. And that could be because it's your birthday month, or it's simply the month your Part A was backdated to. In this scenario, you would have 3 months that you were not on Medicare: January, February, and March. And since you were not enrolled in Medicare during 3 out of 12 months, you can contribute 3/12 of the HSA maximum for the year, as well as 3/12 of the catch-up contribution. An important note about the timing of your contributions. In our example, we said you can contribute 3/12 of the HSA max. That would be for January through March. But you can still contribute in April through December, actually even up to the tax deadline the following April. Don't be too concerned about when you contribute for that tax year. Just don't exceed the prorated amount for the year your Part A begins. So be very careful to not over-contribute in the year you plan to start Medicare and/or Social Security benefits. The excess contributions will create some tax consequences. And speaking of tax consequences, that's our next topic. If you over-contribute to your HSA, which the IRS calls excess contributions, there are 2 tax issues to be aware of. Number 1, excess HSA contributions are not tax deductible, so it kind of defeats the purpose of making the contributions. Number 2, excess HSA contributions are subject to a 6% excess tax for any tax year that those contributions are still in your HSA account. So please avoid over-contributing. Lastly, what can you use your HSA for on the Medicare side, and what is not allowed? You can use your HSA for any qualified medical expenses approved by the IRS, including, but not limited to, premiums paid to Medicare, such as Part B, Part B IRMA, Part D IRMA, premiums paid to an insurance carrier for a standalone Part D prescription drug plan, premiums paid to an insurance carrier for a Medicare Advantage Part C plan, medical deductibles, copays, and coinsurance, prescription drug copays, dental, vision, and hearing costs. You cannot use your HSA to pay for a Medicare Supplement Medigap plan premium. This particular plan type is specifically mentioned as a disallowed expense in IRS Publication 969. But you can use the HSA for any deductibles, coinsurance, or copays associated with that Medigap plan. Please watch our companion video right over here titled When Medicare Part A is Backdated 6 Months to learn more about Part A backdating and how it negatively impacts your HSA.